Hi, I'm Molly. I'm a senior nursing student at Springfield Technical Community College. The following video should only be used as a teaching tool. Now, as you can see, I have all of the supplies I need laid out in front of me. My insulin syringe, the insulin, gauze, alcohol swabs, gloves, and the injection pad, which is used to stimulate the adipose tissue in the body. Depending on your blood sugar levels and your sliding scale for insulin, you should choose the appropriate amount of insulin in units. Remember, insulin is a medication that is given in units, not milliliters, so be sure that you ever only use insulin syringes that have the proper unit markings. For the purpose of this demonstration, I will be drawing up 10 units of insulin. To start, sanitize the top of the insulin bottle with an alcohol swab. Next, remove the plastic cover that covers the needle, and then draw up the number of units you need in air. After, with the insulin bottle on the table, insert the needle into the bottle and inject the air with the syringe plunger. Then, tip the bottle with the needle still inside, upside down, and draw up the number of units you need, the same amount that you injected in air. Then, with the needle cap on a hard surface, scoop the cap with the needle without the tip touching the surface. After, open your gauze pad and leave it in its packaging. Next, choose an injection site. You can inject insulin into your abdomen, the back of your arms, the top of your thighs, and the top portion of your buttocks. If you are injecting into your abdomen, make sure that you choose a site at least 2 inches away from your belly button or any scars you may have. Then, take an alcohol swab and clean the area you choose. Start in the center and move outwards in a spiral motion for at least 2 inches. Make sure you don't go back over the same spot again with a soiled swab. Hold the syringe in your dominant hand and remove the needle cover. With your non-dominant hand, grasp about 2 inches of skin and pinch. This is to be sure that the insulin is injected into the fat tissue and not the muscle underneath. That could cause the insulin to be absorbed too quickly. With the skin pinched up, make a quick darting motion with the syringe into the skin at a 45 to 90 degree angle. And then slowly inject the insulin with the plunger. Injecting the insulin too quickly can cause pressure on the surrounding tissues and associated pain. Remove the needle. Remember, never to recap your needles. Immediately dispose of your needle in the biohazard box provided. If you experience any bleeding, use the gauze to hold pressure to the area until the bleeding stops. Do not massage the area. Doing so can cause the insulin to be absorbed quicker than normal. When choosing injection sites, make sure to rotate them to avoid lipoatrophy and hypertrophy. Don't forget, your prescribing doctor's office can answer any further questions.